Good afternoon, guys. This is discussion A about frailty and the care in hospitals the elderly people receive that are frail. So we'll discuss that tonight for A. So please join me for the discussion A. Okay, here we go. The phrase refers to a study indicating that most UK hospitals are not routinely screened screening older surgical patients for frailty despite its significant impact on recovery and complication risks. Frailty, a condition common in older individuals, is associated with reduced muscle strength, fatigue, slower walking pace, and increased vulnerability. The research led by the Royal College of Anesthetists and University of Nottingham found that 71% of hospitals were not assessing patients age 60 and over for frailty. Okay. Experts recommend using the clinical frailty scale or CFS to evaluate patients as frail individuals tend to stay 3 to 6 days longer in the hospital post surgery and face higher risk of complications, delirium, and give me 1 second, guys. Mortality. Implementing routine frailty assessments could improve patient outcomes and hospital effectiveness. Okay. Frailty significantly impacts surgical outcomes, making procedures riskier for older patients. Studies show that frailty is one of the strongest predictors of uh, post-operative complications, prolonged hospital stays, and increased mortality rates. Frail patients are more likely to experience delirium, infections, slower wound healing, and functional decline after surgery. Additionally, frailty affects discharge, disorientations, with many patients requiring rehabilitation or long term care instead of returning home. Some hospitals and healthcare systems are recognizing frailty as a critical, a, a crucial factor in preoperative risks. Assessments. Okay. Helping surgeons and patients make more informed decisions about treatment options. Frailty, frailty increases the risk of several post-operative complications, making recovery more challenging for older patients. Some of the most common complications include delirium, that's confusion in English for y'all, and cognitive impairment after surgery, often linked to anesthesia and prolonged hospitalization. Infections. Frail patients are more susceptible to pneumonia, urinary tract infections, and surgical site infections. Cardiovascular issues, increased risk of arterial fibrillation and other heart related complications. All right, give me 1 second. Prolonged hospital stays. Frail individuals tend to require extended recovery periods, delaying discharge, functional decline, loss of mobility and independence, sometimes leading to longer or long-term care needs, higher mortality rates. Frailty is strongly associated with increased risk of death within 30 to 90 days post surgery. Hospitals are increasingly recognizing frailty as a key factor in surgical risk assessment to improve patient outcomes. Would you like to explore strategies for mitigating these risks? Preventing post-operative complications in frail patients requires a multifaceted approach that addresses their unique let's see vulnerabilities. Okay, here are some effective strategies. Post-operative optimization, frailty assessments, nutritional support, and physical conditioning before surgery can improve resilience. Okay, multi-component post-operative interventions. Studies suggest that combining exercise, nutrition, and tailored medical management reduces complications and hospital stays. Okay, enhanced recovery after surgery, or ERAS protocols. These evidence-based guidelines focus on minimizing surgical stress, optimizing pain management, and encouraging early mobility. Okay, then you've got geriatric co-management involving geriatric specialists in surgical care, improves outcomes by addressing cognitive function. Okay, hold on. Be right with you. Medication management. And rehabilitation needs. Post-operative monitoring and rehabilitation. Close monitoring for delirium, infections, and cardiovascular issues, along with early mobilization, helps prevent functional decline. Would you like insights on how on specific interventions tailored to different types of surgeries? And then we're going to get into advanced recovery after surgery. or ERAS, is a patient-centered, evidence-based approach designed to improve surgical outcomes and speed up recovery. It involves a multidisciplinary team working together to minimize surgical stress and optimizing psychological function before, during, and after surgery. Key components to ERAS: post-operative preparation. Patients receive education, nutritional support, and pre-rehabilitation exercise programs to improve resilience. Minimizing fasting. Minimal fasting instead of prolonged fasting. Patients are encouraged to consume a carbohydrate rich beverage a few hours before anesthesia. Okay, multimodal multimodal pain management, ERAS. Protocols emphasize reducing opioid use by incorporating regional anesthesia, NSAIDs, and other pain control methods. Early mobilization. Patients are encouraged to get out of bed and move as soon as possible after surgery to prevent complications like blood clots and pneumonia. All right. Optimize postoperative care. Focuses on early re reassumption of normal diet, activities, and reducing hospital stays and improving recovery. Studies show that ERAS protocols lead to faster recovery, fewer complications, and shorter hospital stays. Hospitals worldwide uh, are adopting ERAS to enhance patients' outcomes across various surgical specialties. ERAS protocols are tailored to different surgical specialties to optimize recovery. Care principles remain the same: reducing surgical stress, optimizing pain management, and encouraging early mobility. Specific adaptations are made based on the type of surgery. Okay, next page. Differences across surgical specialties. Okay, colorectal surgery, EAS, was originally developed for colorectal procedures, emphasizing bowel preparation early, feeding, and multimodal pain control to reduce lesions and complications. Orthopedic surgery, hip and knee replacements, focus on regional anesthesia, blood loss management, and aggressive early mobilization to improve joint function and reduce hospital stays. Okay, cardiac surgery includes preoperative optimization, for cardiovascular function, fluid management, and early uh, exacerbation to enhance recovery. Okay, gynecological obstetric surgery, EAS protocols for uh, high, hydra, high, hysterectomies and obstetric. Let me get this other word. Sections emphasizing minimizing opioid use and early embolization and nutritional support. Okay, then there's liver and pancreas surgery. Given the complexity of these procedures, ERAS focuses on nutritional optimization, fluid balance, and minimizing surgical stress. Neurosurgery and spine surgery prioritizes pain management, early mobilization, and reducing opioid dependency to prevent complications like deep vein thrombosis. Hospitals and surgical teams continuously refine EAS protocols based on emerging research and patient outcomes. Would you like insights on how EAS, ERAS improves recovery for specific type surgery? Okay, guys, that's A for today. I'll be back on shortly with B after dinner. I'll see everybody shortly for B after dinner. Till then, Gator Wellness, take care, folks.